In 1984, in the United States, there were reports of 100,000 facelifts, 100,000 eye lifts, 56,000 nose procedures, the three most common procedures to change our looks. Why aren't we happy as we are? And how can we avoid trouble if we do choose to buy a surgical change? Roz Yeager-Kupferman is a feminist counselor and a psychotherapist in Englewood, New Jersey. She specializes in body image issues. Roz Yeager-Kupferman, you counsel women and many men who are not at peace with the way they look. Some want to make peace with their body image, and some want to make a change. At 14, you made a change. Tell us about it.
At 14 years old, I had already sort of been on this earth 14 years, obviously, and had experienced a great deal of derision, humiliation as a child. And when the opportunity arose during that year, I had finally revealed it to my parents, and they were not very wealthy at the time, but somehow or other they scraped up enough money at that time. I think it was around 1948. A nose job cost $500, and my father, who was a grocer, managed to scrape up the money and went for an interview to a plastic surgeon in New York City and decided to have it done. I was very happy at the time because I had great expectations that my life would change drastically. And in a way it did, because having eliminated that obstacle, I felt freer, I felt more capable to participate without anticipating humiliating comments or derisive comments from my peers who were teenagers and always looked for a sign or a particular signal to use against you.
Roz, when you had this done, do you think your expectations were appropriate, or do you think you expected more than it turned out?
I think they were appropriate to some extent, not very shortly thereafter, but as life proceeded, obviously, my fantasies about everything changing and it being the only thing that I could depend on, obviously, clarified itself. But largely, it did give me an entree into areas and a certain amount of strength that I gained from feeling more acceptable and not anticipating comments from people or stares. Or by that time, of course, I had a self-image, you see, and I was very aware that there was something different, something wrong. So there were times when I would withdraw. And that sort of subsided as time went on.
Now, you have a two-generation story in your family.
Yes, I do, as a matter of fact. About a year or so ago, my son, who had a somewhat prominent nose, not as prominent as I felt mine was, but then, of course, that might be the residue of how I still felt about my appearance. He revealed that he was having the same type of experience, and was very sad about it, and also began to encounter similar experiences in groups, you know, in classes and at school or parties, and it seemed to come from kind of nowhere. Up until that time, he had a very strong ego and was a very feisty, outgoing kid. And then at about age 12 or 13, he began to experience the same kind of thing and couldn't really understand it, was quite shocked and appalled by it, and began to withdraw. He didn't tell us about it for several years thereafter, and when he was 17, finally revealed it, and I very quickly acted on it.
And was it a positive outcome?
Very positive, very similar to my own. He feels very good about it. He feels freer. Still, though, the same impressions of life-changing radically is sort of a shock. It doesn't, and he's very perceptive about some of his withdrawal and realizes that the recurrence of it or the persistence of it is based on those old feelings.
Now, a lot of the people that come to you as a professional, as a helping professional, to talk about their not being at ease with their body image. What do they expect out of surgery? Are a lot of their expectations rational or unrealistic?
No, I think they're quite rational. I've had several people, different types of issues, not always noses, facelifts. There are people who become compulsive about it. There's one woman who I've been seeing who's had all sorts of tucks and removals of aging signs, and that I feel is a bit excessive because it's really holding back the reality of life. But if a person is younger and it can alter this feeling that I've described, which I experienced in my son, then I think it's very rational, and I think it does definitely affect your future. It gives you a certain amount of strength. After all, our culture is based on very often looks, appearance, and how one feels about that. The ads, the media, everybody presses on with beauty, with youth, with slimness, and so on. And to some extent, I think adhering to it is very appropriate. I think when it gets out of hand, though, and you continue and persist in doing it, holding back aging and all that sort of thing, then it's very, very inappropriate and very destructive, because it speaks to not the unwillingness to accept certain changes in life.
Let's find out what changes there are available out there surgically. Roz, your coverman, stay with us.
Okay.
Let me introduce Dr. Helen Colen, who's a specialist in plastic surgery and in microsurgical techniques. She's at New York Ioneer Hospital, Cabrini Hospital, and Long Island Jewish Medical Center. Dr. Colen, can you lay out for us what is available in plastic surgery? And let's try to separate it into both the cosmetic area and the reconstructive, two different fields.
Many new techniques and many different techniques are available in dealing with various problems that people are faced with. In the cosmetic field, of course, the rhinoplasty or the nasal surgery is available. Facelift for aging person, ear tucks for prominent ears, breast reductions for very buxom people, breast augmentations, tummy tucks, and suction lipectomy for prominent hips.
That's where you literally suck out the fatty tissue.
Right, has become available in recent years. Of course, we also have eyelid surgery for prominent bags under the eyes or for saggy upper eyelids, forehead lifts for people with many wrinkles and frown type look. There are surgery to remove extra fat from the neck area, a neck lift, arm lift, and most cosmetic deformities can be dealt with today. As far as the reconstructive aspect of plastic surgery, basically when a surgery is being done for cancer or for trauma, there are nowadays techniques either through conventional reconstructive measures or through microsurgery, which is a more advanced technique in reconstructing the area to make it look as best as possible.
One that comes to mind immediately for me is breast reconstruction after a mastectomy. What would use microsurgical techniques?
Breast reconstruction can be performed in various ways. One could be just putting an implant or a tissue expander to expand the breast area. One would be to use a muscle from the back or fat and skin and muscle from the tummy, which of course these do not utilize microsurgery. And there also could be a microsurgical transfer of tissue from somewhere else to the chest area. And that's usually done where the other techniques are either not possible or have failed.
We're here at 212-267-WNYC. Do you think that we should strive to be perfect? What do you think about our culture, which is very interested in the way we appear? Daniel Shapiro is a partner at Shapiro, Baines, Asato, and Shainwald, a practicing attorney, but he used to practice as a physician since 1960 and joined the bar in the late 70s. Daniel Shapiro, you handle people who maybe have had a little run-in with medicine. People who want to do plastic surgery, how should they go about it? And if they get into trouble, what should they do?
I assume you mean you're asking me the physician who wants to do plastic surgery?
No, excuse me, the patient who wants to get something done, is going to buy a service. How do you shop for that kind of service, and how do you avoid getting into trouble as you go along?
Well, I would assume that most people seeking a physician to do plastic surgery will get advice from either their own general doctors or from perhaps friends who have gone through this kind of procedure themselves. I really can't tell you how people arrive at their plastic surgeon, but I would assume at least that you can research it a bit, and you can, in fact, I think it might be a very good idea for people to shop around a bit and speak to one or two different surgeons before they made their mind up.
What happens if they get into some kind of trouble? Because I'm sure Dr. Colen in a moment can tell us how to select a person that you would want to work with. What happens? How can you avoid getting into trouble, and what happens if you do?
From the part of the patient point of view?
Yes.
Okay, in other words, how to prevent a patient from becoming a client of mine or some other attorneys? Well, I don't know exactly what to tell you about this, except to say that I do realize that a number of people do go to plastic surgeons for a kind of result. They expect their lives to be changed, and when their lives aren't changed, we see them as potential clients. I can understand that. That's one part of it. We also, of course, see people who haven't been treated all that kindly by their surgeon and by their plastic surgeon, and in fact the results are not just bad results, but bespeak some kind of careless treatment.
Well, let's separate those two things then. What do you say to a person who comes to you saying, I expect it to look like, pick out your ideal beauty object, and I don't? What do you tell them if you think their expectations were just unrealistic?
Listen, we're dealing, at least as an attorney, I'm dealing with people who have been carelessly treated. If they don't arrive at their expectations, if they are not Marilyn Monroe or you name it, whatever person, that's not negligence. That isn't something that's actionable from the point of view of law. What we're really looking at here as an attorney, all I'm looking at, is people who have been negligently treated, carelessly treated, and so forth. We are not trying to correct, well, let me withdraw that. We don't take cases of people who just don't have the result they expected. That's not negligence.
So what kind of case do you take?
We take the cases where there has been carelessness on the part of the operating surgeon. There are many different kinds of carelessness. There are death actions, believe it or not, in the fat lipectomies. We have that sort of case in the office. There are infections that occur that could have been prevented and that are not treated appropriately. I could go on. I don't want to give you a laundry list of the kinds of case we take, except to say that there are many people who are operated upon. In fact, right now in New York, there are a number of lawsuits in one particular group that's been doing surgery that should not have been doing the surgery. Okay, they should not have been doing the surgery on the people that they have. I'm trying to be a little bit, what's the word?
Oblique?
Oblique, yeah. I'm not trying to name people or whatever have you, but there are people who advertise a great deal and have been advertising a great deal and have raised the expectations of their potential patients to such an extent that they could not possibly have had the result they're looking for.
212-267-WNYC. What do you think of trying to make yourself, well, nearly perfect if you can afford it? Is that how you should spend your money? Dr. Colen, how do you shop for a plastic surgeon?
I think that probably the best way to find a plastic surgeon is either through a personal physician recommendation or by making sure that the doctor is qualified, maybe by calling the County Medical Society or the Society for Plastic Surgeons, to see what kind of affiliations with which hospitals a doctor has, and perhaps speaking or meeting some patients that a doctor has done. And through contacts, personal contacts with other patients, or through their personal hospital or physician.
Now, it's my understanding that once you have an MD degree, you can do plastic surgery without, say, board certification or whatever. So if that's true, shouldn't you then find out as a potential patient specifically the specialized training of anyone going to work on you?
Absolutely. Once you finish medical school and perhaps part of the whole residency training, you do have an MD degree and you have a license to practice medicine or surgery. And it has become quite important to find out whether the doctor has the board certification and whether this particular doctor has had the appropriate training and experience that you are searching for.
What about, as a physician, as a specialist, what about the ads we see running on TV for plastic surgery?
I personally do not know the people who run those ads or their performance in surgery. Whatever way you find a physician, whether through an ad or through anyone that have told you about someone, you must check it out yourself before you just go to someone because of an ad. You would not probably choose a neurosurgeon from an ad, and you wouldn't choose a cardiac surgeon from an ad. And plastic surgery is just as much medicine and surgery as other fields. So you must make sure that you have a good doctor.
212-267-WNYC. Thanks for calling us from Queens.
Yes, thank you for taking my call. I have a question. I guess it's open to the lawyer. A friend of mine has had 3 rhinoplasties done, one on top of the other, within a matter of like 6 months. And it was done by a center that's been in the news of late without mentioning names. And I know that they are currently under a lot of litigation and lawsuits. And I'm just wondering, what is her legal recourse since she didn't get the job that she wanted done and she's unsatisfied? And she's not at all willing to go back to this place, and she was treated unfairly, and she got a second opinion, so they should have never done 3 rhinoplasties like that, one on top of the other. And I'm just wondering, what is her legal recourse, and do you have any suggestions?
Daniel Shapiro.
Well, it seems to me that if she has gone to a subsequent treating physician who says that they never should have done the original procedures in the fashion that they were done, that there may well be negligence in the way the initial surgeries were done. And at such a point, she should see an attorney who will obtain the records, review the records, and probably should refer the case out to another plastic surgeon who would review the original surgeries, so that you can get an informed opinion as to whether the first surgeries are well done. Now, in other words, most attorneys should, without question, have the original records reviewed to see what was done incorrectly.
Will this woman's friend have to put money up front? I think if there's been an expense already, she's wondering, I think on some level, what more is this going to cost me? How does that work?
Well, lawyers in the personal injury medical malpractice field work on the contingency fee basis, and that means basically that if their client has no recovery, the attorney gets no recovery for the legal work that the attorney performs. There's no upfront retainer fee that has to be paid. Expenses, of course, according to our appellate division rulings, are payable at the end, but that's a separate issue.
Thanks for calling us.
Thank you very much.
212-267-WNYC. Are you, as an attorney, likely to be able to get another physician to criticize the original physician?
Listen, all I ask for is an honest review of the physicians that I speak to. Okay? I only ask them to be straight and honest with me. I've got a slight advantage because I am a physician. A lot of this plastic surgery, certainly the eye lift things, I used to do myself. So that I've got a reasonable idea myself whether or not malpractice has been committed, but I never go just on my own opinion. I always get other people's opinions.
212-267-WNYC. I don't want to lose touch with Roz Yeager-Kupferman. Roz, who do you feel is a good and then a bad candidate for a surgical change?
There is a term in my field called borderline, and when I see somebody for a while, I can usually determine where their rationality is, whether it's just a neurotic problem that can be dealt with within a reasonable amount of time, or if the person is borderline, meaning that he sort of has one foot in one world sometimes and another in the real or rational world of logic and predictability. So if a person after a while appears to be somewhat irrational or borderline, I would certainly work with that as a dynamic, eliminating any drastic changes or decisions for him or her in order to avoid the kind of thing that we're talking about, the prediction of devastation, disappointment, and unrealistic expectations about what life is going to produce for the person after the operation. Indeed, there are some very, very devastating statistics about transvestites who go in for surgery and expect life to be absolutely wonderful after they experience a sex change, and very often there is suicide ensuing.
You mean transsexuals, yes?
Yeah.
As opposed to just wearing transsex clothes, changing. I'd like to hear from Dr. Helen Colen. Do you feel there is a difference within your specialty of the skills or sensibilities of women plastic surgeons versus men? Do you see any differential there?
As far as ability, is that what you're asking me?
Or is there more of a feeling for, say, a woman who has breasts doing breast surgery, or am I merely throwing out something that doesn't have sex lines?
No, I think that once you become a physician, whether you are a man and a woman or a woman, and if you're well trained, there should be no difference in the service that you can provide a patient.
How about your bed or desk side manner? Do you see any difference among your colleagues?
Every person, whether they're a lawyer or a physician or whatever, has their own personality, which when you work comes out. And that's where when a patient comes to see a physician, very often they'll choose a physician according to how they feel about the rapport that they have established with that particular doctor. And some patients do feel better, especially those having breast surgery done, going to a female. But that's basically a personal type of a rapport or a personal choice, rather than there should be a difference between the abilities of two physicians because of sex.
212-267-WNYC. Thanks for calling us. What's your question or comment?
I have a comment. It seems to me that when you have a family trait, a physical family trait, that seems to the people of that family to be unacceptable by society or someone, there's something wrong with the family. And it goes through generations, as the therapist said, the son, the mother, the son, and then that child's son or daughter. It seems that the necessity to change a really deep identity to be accepted by a very frivolous identity that is put upon us, I think that's not therapy. I think that's something very egotistical and very sad. I really do.
Do you think it's more the attitude toward the nose than maybe the nose that was inherited? Is that what you're saying?
What I'm saying is that the nose that is inherited should be something that one would feel good about. Why should I mean, I know that there are problems, but it would seem to me that the therapy would be much more sensible to try to have the person who suffers these things to understand that the nose is a great, marvelous thing. And I think that with plastic surgery and the wonders it can do, it really should be reserved not for this kind of egotistical and self-denying kind of thing, but kept to the people who really are born with horrible injuries or birth defects, in which plastic surgery does marvelous things. I think that it's nothing more than a sign of a terrible egotism and a terrible pandering to a society that has a very peculiar sense of values.
Thanks for calling, speaking for ourselves.
Okay.
Do you think plastic surgery is a frivolous buy or something that you're entitled to? 212-267-WNYC. You're calling from New Jersey. Thanks. You're on the air.
That person's question was very interesting. My question was, who are the people that are going for plastic surgery? Are they more? I assume they're more women than men. And what nationalities? What ethnic backgrounds? Because people must have an image of themselves that they don't like, and maybe it's not their image that's wrong. Maybe it's how society looks at that image. So you have a big nose. Barbara Streisand has a big nose. She didn't change it. Tony Bennett has a big nose.
Your question about who's going for it.
And another question is, what percentage of plastic surgeons are women? This doctor on here is obviously not born in this country. I assume she may be born in Russia. I don't know.
Let's find out a little bit about both who's coming for plastic surgery, let's not lose your points, and who are the plastic surgeons. Hang on. Dr. Colen, can you address that? Is it more women than men proportionately?
Up to recently, yes. They're usually more women than men seeking cosmetic surgery. Now we're talking about not reconstructive, because in reconstructive, there is no sex difference. And I do believe that the people who are seeking cosmetic surgery usually are those that would like to have a positive change about themselves. They are people who would like to improve their body image.
But are they people of one ethnic group to a greater degree than others, to follow up on what our caller was asking?
Absolutely not. You have people who seek plastic surgery from various backgrounds, whether it's a facelift, we all age, or whether it's a nose surgery. I must emphasize, however, that depending on the background, one has a different structure of a nose. Perhaps someone who is from Oriental background doesn't have a nose that has a hump or a big nose. They may seek to change the bridge of the nose to make it higher rather than flat, if it's flat. So the type of surgery that you provide depends on the type of quote-unquote deformity that you start with.
Or is there a ethnically prejudiced ideal? I mean, is the hump nose person want it to look more like a Northern European nose? Does the Asian nose want to look more like a Northern European nose? Do you see anything like that?
Basically, what I see that a person deals with an image of themselves, what they would like to look like. Some people do want to have a more Irish-looking nose, and some people would like to have a more ethnic-looking nose. Everybody is different.
Did you ever get an Irish nose wanting to be a hook nose?
No, that I have not had.
I think your point's well made. Thanks for calling Speaking for Ourselves. And before we go to a break, I'd like to know a little bit about you, Dr. Colen, since our caller brought that up. She says it sounds like you're not born in this country.
Right. I was born in Poland, and I came here when I was in high school. And my training was since then in the United States.
And you are, as a female, a growing minority within plastic surgery, but what are the numbers at this point? Women versus men?
There are quite few women at this point. I think when I finished my training at that point, there might have been 3 or 4 women plastic surgeons in New York. I am not familiar with the exact number across the country.
We're talking about plastic surgery, cosmetic and reconstructive here on Speaking for Ourselves at 212-267. About plastic surgery here on Speaking for Ourselves with Daniel Shapiro, partner with, I'm going to get it right this time, Shapiro Baines Sasto. Shapiro Baines Sasto and Shane Walden, Dr. Helen Colen, reconstructive plastic and microsurgeon, and Roz Yeager-Kupferman, psychotherapist in private practice. Thanks for calling us from Queens at 212-267-WNYC. Hi.
Hello. I'd like to say this to the hostess and her guest. First, let me preface my question by making these remarks, this comment. I think that the people who called had very lofty motivations in saying, well, it's a family feature, and it's part of your personality, and why do anything about it? I happen to disagree with that. I think that one should do anything that they feel is possible if it makes them feel better about themselves, and no matter what it is. And so much for that. I'd like to ask the lawyer this question. Say if I was to entertain those thoughts of having my face lifted, which I'm not presently, but whenever that time comes that I feel that way, with hearing about these suits and the segment given to this person who didn't, the woman who called before and wouldn't answer give the name, and I don't intend to. There was a segment on that doctor on 60 Minutes one Sunday night, and it was very frightening to me, and I think that's what would keep me from going. I'd like to know what your attorney has to say about that.
Daniel Shapiro, what about the fear?
Look, there are more good doctors, obviously, than there are bad. There is a very small minority of doctors who, and I keep on using my words carelessly and negligently, do the work they do. Most doctors are good guys, good women. They do their work. They're well trained, well prepared. The fact that there are some people who cannot perform properly is why there are lawsuits. I would not be fearful of getting necessary surgery or even elective surgery just because there are some bad people. Check it out yourself. Look through it yourself.
Thanks for calling. Dr. Colen, can you tell me about something I did see briefly on TV, and it looked like a great idea, which was a new sort of laser TV where you can almost see the way you might look if you chose to go ahead with a procedure. This sounds like sort of space age, look into the future technology. I'd love to hear more about it.
Very often when a patient comes to the office for a rhinoplasty or any type of change in the configuration of their body, we take photographs by a medical photographer, and then we meet with the patient and the photographs again and discuss the changes that are possible for this particular patient and what the result may look like. I do it often by drawing on the picture itself, and nowadays they have computers that you can show it on the computer what it may look like. The only problem with the computer or whatever method you will show a patient the change that you will do is that the change has to be realistic, and that and it's a type of a change that you can achieve by surgery, not just by drawing on a computer or a picture. So as long as the computerized picture that you see is a realistic picture that can be achieved by surgery, I think it's very nice for the patient to see. 212-267-WNYC. Daniel Shapiro, in your job as a lawyer, do you see people coming in with a picture that they saw of themselves as they were to be reconstructed and they didn't turn out looking like that and they're mad?
Well, let me comment about that. Obviously, a crayon or a pencil isn't a scalpel. And I am just concerned, particularly with the television presentation, drawing on a television screen, that it may lead to an unreasonable expectation and make some very, very disappointed people. Okay? That would be the concern. The crayon can't be a scalpel. Human tissue obviously reacts differently than something that you do on a drawing.
Dr. Colen.
Well, absolutely, and that's where sometimes people get misled. It's very, very important to speak to the patient, to have the rapport, and to tell them what you can achieve with your scalpel. It's not exactly what the computerized image will show. I myself don't use the computerized image. It's very big and it could be a little bit distorted. I like more to discuss the picture and to basically discuss what I will do with the patient myself on a personalized basis. And I find that quite much more realistic.
But again, thank you. But again, that's the whole problem. You see, Dr. Colen, quite obviously you can do a cell. I'm not saying that you do a cell, but there may be some plastic surgeons out there that do a cell with their beautiful drawings.
What's that mean?
That means that you can convince somebody that you really need this surgery, and I'm going to make you beautiful. I'm going to make you Bo Derek. I'm going to make you whomever.
You were saying S-E-L-L. I was hearing C-E-L-L, but we were talking science here. 212-267-WNYC. You're on the air from Brooklyn. Thank you. You're not on the air. Call us back, please. We're talking about plastic surgery techniques. I'd like to cover, if we can, who pays for what? Can you become beautiful on someone else's bank account, or is it straight money out of your pocket? What's covered by insurance, what's not? Can you give us a bit of a rundown, Dr. Colen?
Reconstructive surgery usually is covered by insurance. Cosmetic surgery most likely will not. If you have a septoplasty done, where you don't do a rhinoplasty or cosmetic nose, just a septum correction because of breathing problem, that would be covered because it's reconstructive. Breast reduction nowadays is considered reconstructive if you need to remove a certain amount of tissue, and that will be covered by insurance. Breast reconstruction is covered by insurance, but a pure cosmetic procedure would probably not, unless you are a model or you need it for your profession.
And what is the range in finances? What will it cost?
It's very difficult to say. For a facelift, I think it might be anywhere from $4,000 to $10,000, depending which part of the country you live in and who you go to.
212-267-WNYC. The magic of plastic surgery. Thanks for calling from Manhattan.
Oh, good morning.
Good morning.
I understood that if you have an MD, that you can practice plastic surgery, that you need no further training. Is that so?
Dr. Colen?
That's what I heard early in the program, I thought. I hope not.
Well, once a person gets an MD degree, they basically can practice medicine and surgery, and because they have an MD, and that's what their license says. The other thing that most states require a state license, which you will can apply for and receive.
What sort of license? Is that for surgery?
Just to be a general doctor in the state. You have
yes,
to be.
But after you've got that, what my concern is that you're getting doctors, at least the way I understand what was said, who are chopping up your face and all that, which is quite different, even if you are a surgeon and have practiced hysterectomies.
That's
and
correct.
Things like that, that you're chopping up someone's face and eyes, which is quite different.
That's correct. A doctor who has an MD degree can open an office and say that he is a plastic surgeon or an OBGYN surgeon or a medical doctor, and unless you yourself check further, you may be one of those people that is operated on by
whom
someone.
he's practicing.
That's right.
Oh,
Daniel
dear.
Shapiro has something to add.
Yeah, let me just be absolutely clear. Once you're licensed to practice in the state, let's say the state of New York, the state of New Jersey, whatever, you are fully licensed to do any procedure, medical or surgical.
That's terrible.
Well, it may be terrible. I don't think it's terrible because most people don't venture out of their own bailiwick. In other words, nobody today, and particularly in today's world, goes into areas where they don't have training and experience. If they do, you're right, it's terrible.
I'm afraid that a lot of plastic surgeons are going into it because there's a lot of money in it. And that's the reason that there may be so many lawsuits and so many unhappy women. And I think that it should be publicized that these people are practicing on you. You're their first surgery, eye surgery or whatever, and I think that is simply dreadful.
Thanks for calling us with your remarks. How about lawsuits, Daniel Shapiro? Are they up? Are they down? Are they balancing?
You know, all of the reports I see say that nationally lawsuits are about the same level as they have been for the past 8 to 10 years. Statistically, given the population increase and whatever, there is a slight increase in the number of filings in New York State, which is the only state that has a slight, but a very slight increase. Nationally, the level of lawsuits has absolutely tapered off, and they're about the same each year. They're not increasing at an immense number or anything like that.
Because we do hear how there are so many more OBGYN cases, doctors not doing babies anymore because of lawsuits. This is not the case in plastic surgery?
I can say to you, and I've seen a number of studies, including one very recently issued, and including RAND Institute studies, that nationally the number of lawsuits that are being brought have not increased. Remember, we have a slight increase in population, and if you balance those things out, that's a separate subject, and the insurance industry and malpractice premiums, that's all a separate issue, which we're not here to talk about today. But nationally, at least, there are not more lawsuits than we've been having before.
Let's go to Manhattan. Thanks for calling.
Hi, how are you?
Fine.
I had rhinoplasty when I was about 16 years old. I was really unhappy about the way I looked. And it turned out, I had never had any surgery before that, and there was no way for the doctor to know this. It turned out that I grow scar tissue when I have operations. And so the first procedure was not very successful, and about a year later I had another procedure, which in essence all he tried to do was get rid of the scar tissue that had grown and sort of get back to some kind of a semblance of what he was trying to start with. And I grew scar tissue again after the second procedure, not as much as the first time, and I went to a second plastic surgeon. And this guy said something really important to me. He said, "You're not perfect, but nobody is. And it's time really for you to try and make a decision as to what it is that you want to get out of this." And so a lot of things had changed in my life. I had somehow gotten, in spite of the fact that this procedure really wasn't successful and I looked strange, I had gotten a really good self-image because of other things that were going on in my life. And I decided that it wasn't necessary to do it again. There wasn't any. I was just going to live with what it was. I thought maybe your therapist might comment on that.
I will. I'll ask her right now. Thanks for calling us with your experience. Roz, how about the experience of this woman and sort of making peace with yourself?
Well, I think that the peace probably came as a result of some of the change that occurred, but as she said, and as I had said earlier, one does not expect that this is the ultimate change that's going to influence you. Obviously, time passes and you mature and you incorporate everything that's happening to you, and this is just one of those features. But I want to comment about some of the things
we only have a few minutes left, so you can do that briefly.
That the other speaker spoke about earlier, and that is that when a person does arrive finally at the doctor's office, whether it's a picture, whether it's a computer, or whatever it is, they are sufficiently unhappy and they don't even need that cell. They're there and they want that procedure. And obviously there are psychological implications before and after.
Roz,
it's not the ultimate.
Okay, thanks for sharing all that with on Speaking for Ourselves today. Thank you, Helen Colen, for being on Speaking for Ourselves. And you say a plastic surgery is something that can solve some problems, but not all?
I think plastic surgery is a wonderful tool for many, many people. I think that people look at themselves as they're growing up and occasionally find certain things about their body that they would love to change in order to have a better body image. And if you go to the right doctor and if you have a good rapport with them and if he's a good doctor, you'll probably be happy.
Thank you, Dr. Helen Colen. And Daniel Shapiro. And if things go wrong, there's help from the courts and from someone with your expertise?
Look, if somebody is careless with you, in any field, you're entitled to some sort of recompense.
Daniel Shapiro, thanks for being on Speaking for Ourselves today on AM 83 WNYC. This is New York Public Radio.